webinar series, Dharma Veda. But before starting our series, let us go down to Lord Dhanvantari and let us take his blessings. And I invite Dr. Rupali to please say Dhanvantari Stavan. Dr. Rupali, please.
Dhanvantari Vandana. Namami Dhanvantarim Adidevam Surasurevanditam Pada Padmam Lokir Jararuk Bhai Mrityunasham Dhataramisham Vividoshadhinam Chavyoma Vatava Varnim Pancham Prapanchatmakam Dehabhajam Santapa Sampata Jara Jwarantam Namami Dhanvantarim Adidevam Navina Neelam Udkanti Kantam Shantim Harer Dvadasham Makhyamurtim Purtim Shatanam Sumanorathanam Namami Dhanvantarim Adidevam Namami Dhanvantarim Adidevam Namami Dhanvantarim Adidevam. Dhanyavad.
Thank you, Dr. Rupali. So as you all know, NIMA has a glorious history of 75 years. And NIMA has been tirelessly helping. Am I audible? Yeah. Am I audible?
Yeah, go ahead.
Okay. So NIMA is tirelessly working for ISM graduates all over the world for the rights of the ISM graduates. And NIMA is also helping the graduates, the students and the practitioners of Ayurveda to increase their knowledge and so that they can do the specialized practice. And that's the reason NIMA has started and has come up with the specialized societies like Proctology Society, Obstetrics and Gynec Society. And now we all know that the importance and the scope for integrated practice in dermatology. So that's why NIMA has come up with a new society, that is a Dermatology Society. Now, I would request our President of Dermatology, NIMA Dermatology Society, the respected and ever enthusiastic Dr. Shivanand Patil sir, to please share aims and objectives and of the Dermatology Society. Shivanand Patil sir.
Thank you, Dr. Priyapatki madam, the organizing secretary of NIMA Dermatology Society. It gives me an immense pleasure to introduce NIMA Dermatology Society. So let me address our main key aims in the Dermatology Society. Our first aim is to develop the integration in between traditional Ayurveda with modern technologies. So that is producing a bridge between the Ayurveda and the advanced therapies. Second is to provide medico-legal guidance and the support to the registered dermatology society members. Third, NIMA Dermatology Society is going to design the course for BMS graduates. Then NIMA Dermatology Society is going to organize webinars. Every month we are going to invite several guests throughout India and across the globe to share their experience in the dermatology. Then we will be launching the essay competition for BMS undergraduate and postgraduate students, just to inculcate the research-oriented approach throughout the UG. Then we are going to introduce the poster making competition for the UG and PG students to create the interesting to create the
Sorry?
I request to...
Yeah, please everyone mute yourself. Please be responsible, and throughout the session, please mute yourself. Otherwise, it will be interrupting to the organizers as well as for the guest speakers. Then we are going to have the seminars at national and international level. Then we will be conducting the workshops, hands-on training for the registered dermatology society members. Then soon we are going to launch dermatology e-news magazine for the dermatology. So all these activities we are going to carry from this month onward, and the eligibility to become the member of the dermatology society is anyone who is completing the degree, diploma or a certificate course in the dermatology. They can contact the office bearers or become a member of the society. Joining fees will be for the registered NIMA members, it will be 5,000 rupees, and for non-NIMA members, it will be 7,000 rupees. It is a lifetime fees. So likewise, this is just beginning of NIMA Dermatology Society, and we will be updating ourselves throughout our social media handles, that is the Facebook and the Instagram. Thank you very much, Dr. Priya Madam. Please continue.
Thank you, Dr. Shivanand Patil, sir. It was very nice, and I request all of you to join the Dermatology Society. Now, I would like to invite respected Dr. Ashutosh Kulkarni, sir, Treasurer, NIMA Central Council, to express his views on Dermatology Society. Dr. Ashutosh Kulkarni, sir.
Okay, yeah.
Yeah, thank you, sir.
Good. Good afternoon, everyone. And first, I congratulate Dr. Shivanand Patil and whole team of Dermatology Society of NIMA. Within 1 month, ज़्यादा से ज़्यादा हमारी डर्मेटोलॉजी सोसाइटी फॉर्म के 1 से 2 महीने भी नहीं हुए हैं। इस बीच जो डर्मेटोलॉजी सोसाइटी की उड़ान है वो काफ़ी अच्छी है। इसी तरह से हम लोगों को आगे बढ़ना है। सेकेंडली, जो भी डर्मेटोलॉजी सोसाइटी के एम्स एंड ऑब्जेक्ट्स अभी हमारे प्रेसिडेंट ने बताए, डॉक्टर शिवानंद ने, उसी तरीके से हमें जाना है। उसमें थोड़ा सा एक करेक्शन मैं करता हूँ कि जो भी हम लोग सर्टिफिकेट या फेलोशिप कोर्सेज फ्रेम करेंगे तो वो विथ कोलैबोरेशन ऑफ रीजनल यूनिवर्सिटीज और दैट इज हेल्थ यूनिवर्सिटीज. Means in Maharashtra we type with Maharashtra University of Health Science, in Karnataka that is Rajiv Gandhi Health University and so on. तो उनके कोलैबोरेशन से हम लोग ये कोर्सेज स्टार्ट करेंगे और हो सके उसमें अगर हो सकता है तो आयुष या NCISM उनकी तरफ से भी हम लोग एक्रेडिटेशन वो हमारे कोर्स के लिए ले लेंगे. सेकेंडली, जो एक डर्मेटोलॉजी की जो स्ट्रीम है, जो भी डे बाय डे इंक्रीजिंग स्ट्रीम है, बढ़ रही है, उसमें जो भी हमारे लीगल प्रॉब्लम्स हमारे पार्टिसिपेंट्स को आएंगे, उसके लिए हमारा जो निमा का एक लीगल सेल है, उनके साथ में एक निमा डर्मेटोलॉजी सोसाइटी की एग्जीक्यूटिव कमेटी की एक मीटिंग भी हम लोग अभी जल्दी रखेंगे, ताकि जो भी प्रॉब्लम्स उसमें है, लीगल प्रॉब्लम जो भी आ सकते हैं या कोई अगर आपके इसमें हो गए कि ये प्रॉब्लम आते हैं तो उसके लिए क्या सोल्यूशन निकालना है, क्या नहीं, ये सब हम लोग उसमें डिस्कस करेंगे. और हमारे जितने भी मेंबर्स बनेंगे वो मेंबर्स के लिए वो हम सर्कुलेट करेंगे भी जल्द से जल्द. अभी तो हमारी नेशनल लेवल की कमेटी फॉर्म हुई है. विद इन शॉर्ट पीरियड्स हम लोग हर एक स्टेट की डर्मेटोलॉजी सोसाइटी फॉर्म हमें करना है. तो इसीलिए आप सब लोगों से रिक्वेस्ट है कि ज़्यादा से ज़्यादा पार्टिसिपेंट्स इसमें लाइए और उसके लाइफ मेंबर बनिए, ताकि हम लोग हमारी सेंट्रल बॉडी भी मजबूत कर सके और हमारे हर स्टेट में हमारी डर्मेटोलॉजी सोसाइटी की स्टेट ब्रांच भी होगी. इसी तरह अभी एक लेटेस्ट न्यूज़ आपको दे रहा हूँ कि अभी कल ही सेंट्रल निमा ने डिसाइड किया कि एक हमारे अभी डर्मेटोलॉजी सोसाइटी हो गई, OBGY सोसाइटी हो गई, प्रोक्टोलॉजी सोसाइटी है, पीडियाट्रिक सोसाइटी सब हो गई. अभी सर्जिकल सोसाइटी का कल अनाउंसमेंट किया. उसके लिंक के थ्रू विद इन 24 आवर्स 400 डॉक्टर्स जो है वो उन्होंने ज्वाइन किया है. उनकी भी हम लोग अभी जल्दी ही नेशनल एग्जीक्यूटिव डिक्लेयर करेंगे. तो अभी ज्यादा टाइम नहीं लेता हूं मैं। आप सभी को डर्मेटोलॉजी सोसाइटी जो हमारे नेशनल टीम है, सभी को मेरी तरफ से हार्दिक बधाई और इसी तरह से अपना काम आगे बढ़ाइए। थैंक यू, धन्यवाद।
Thank you, Dr. Kulkarni sir. And definitely with your advice and with your blessings, Dermatology Society will grow. We'll definitely work towards it. And now I welcome and invite respected Dr. Vinayakji Tembonika sir, President of NIMA Central Council, to please give presidential address to the Dermatology Society. Please, Tembonika sir.
Hello, good afternoon all. Am I audible?
Yes, sir. Good afternoon.
Yeah. Thank you. First of all, I welcome all the members who are present in this webinar in the family of NIMA Dermatology Society. And I thank Shivanand and his team for this beautiful arrangement, and the attendance is quite good. At present, 241 doctors all over India have been joined this webinar, and the program which the Dermatology Society is being to organize in future, the outline has been told by Dr. Shivanand, and basically these are very basic things, and many more programs are will be organized in the future. I thank the organizers as well as give my best wishes to the Dermatology Society team for this arrangement, as well as the legal matters as told by Dr. Kulkarni. We are there to solve all the legal matters which will come in the way of the practice of our doctors or the doctors of Indian system of medicine. We are here to fight for you. We are here to get you united. We are here to give your rights. So be the members of NIMA, be with the NIMA association, and as Dr. Kulkarni told, we are coming with all sorts of specialty forums or societies, and we are there to fight for all those doctors who face many problems, legal problems, social problems, economical problems, as well as n number of problems we come in our day-to-day practice. And NIMA, the strongest and the biggest organization of doctors in the world. I must share with you, NIMA is the biggest organization working in the medical field in the world. So you are the family members, you have become the members, you are entered in the family of the biggest organization, which is 75-year-olds. And if you are new, you will soon come to know that what NIMA has done for all the ISM doctors. So I will not take much time because we are here to listen Dr. Mahesh and his beautiful lecture. So I extend my warm wishes and to all of you, and I once again welcome all of you. And once again, I thank and congratulate Shivanand and his team. Thank you.
Thank you very much, Dr. Tembonika sir, and for your sparing your time and for your best wishes. And now I'm sure all of us are relieved, and we are very sure that NIMA is with us and we can do the practice, the integrated dermatology practice. So today we have a wonderful speaker and extremely talented practitioner with us to share his knowledge with us. And I welcome Dr. Spurti. I think there is someone has to ask a question. Someone has raised. Dr. Prashant Sharma.
Yes, ma'am. Dr. Prashant Sharma.
Yeah. So do you want to ask anything? Because we have.
Yes, ma'am. I am asking for dermatology course certificate in duration.
Yeah. I think after that lecture, we will solve all the question and answer sessions.
I'm late joining first.
Okay. So we will be giving we have our page also, the Instagram page and Facebook page. So you can join the page and everything is given on that. So you can ask the questions also, because we have the time constraint. We have to listen to the speaker also. So I would request Dr. Spurti Gupta to please introduce our respected guest speaker. Dr. Spurti.
Thank you, Priya ma'am. And very congratulations to everyone for biggest NIMA Dermatology Society in field of Ayurveda, which is very much needed at the time of our. So as a part of our society, we have conducting many webinars, that is Dharma Veda webinar series. As a part of this, today we have started with the first webinar series. And we have very wonderful guest speaker with us, that is Dr. Mahesh P. Savalgimath sir, and very happy to introduce Mahesh sir. In brief, the sir has completed his undergraduations from the KLE Shri BMK Ayurved Medical College, Belgaum. Later, he has pursued his post-graduation, that is MD in Agadtantra from VEDA PS Warrior Ayurvedic Medical College, Kerala. Currently, sir is working as an associate professor and Ayurvedic dermatologist in Shri BM Kankanwadi Ayurved Mahavidyalaya and PG Studies and Research Center, Belgaum. Sir has published more than 20 papers and worked as a resource person for 80 plus papers, seminars, conferences, and workshops. And sir has total 14 years of experience in his profession. And as we all know, sir is very humble, kind-hearted, and very loving to his patients. And he has many success stories treating with his special line of treatment in case of hair and skin diseases. So hope we all be blessed to have sir wonderful sessions. So over to you, sir. I'm requesting Mahesh sir to please take over the session. And please everyone mute yourself so that we can not miss any single word of this, sir. So over to you, Mahesh sir. Thank you so much.
Hello, Namaste. Am I audible?
Yes, sir. Yes, you are audible. Go ahead.
Okay, okay. Yes. Namaste, everyone. And I'm very grateful to Dr. Shivanand Patil, sir, for giving me an opportunity to share my views and interact with you people. And I think thoda introduction thoda zyada hi ho gaya. Okay, thank you very much for that nice introduction. So today we'll be discussing about the importance of Visha Chikitsa and dermatological practice. Like generally speaking, I usually, whenever I go for any presentations and all, my aim will be like making people develop some confidence on use of at least minimum medicines. It should not be general seminar or something like that. We went and we attended, just being part of that. I usually don't like that. So in this, I will make sure that at the end, you will be able to use Bilvadyagada, Dushi Visharyagada, and Patologatorinadi Kashaya, and one more. At least these 4 drugs very effectively in your clinical practice. Okay. So because I have taken cases which are related to only those formulations. So the 10 cases we'll be discussing. At the end of the seminar, you should be able to at least use 50% of them effectively in your clinical practice. So usually when it comes to Visha, we need to think about today in class we were discussing. Visha was not explained as Roga in case of while listing the diseases. It is later explained as Roga because it causes mother kind of thing, Vishamada. So that is why it's included in Chikitsa. So Visha is said to be Hetu rather than disease. So when we consider the types of etiologies, there are several types, like for example, classifications, Sannikrishta, Viprakrishta, Vichari, Pradhanika. So Visha falls in the category of Pradhanika. So whenever there is etiology is Mrudu, disease is also Mrudu, Madhyama, moderate. If Tikshna like etiology is there, the clinical manifestation is also Tikshna or very severe in nature. So this is very important, which is said in all the texts, explain this one, basic principles of Ayurveda. But when it comes to treatment, not like telling against anybody, but when it comes to treatment, we all like when it comes to simple example, like fever is there. So irrespective of the etiology, what was the etiology, we start giving same line of treatment, like Amrut Tarkashayar, Amrut Arishta, whatever, okay, Triboni Kirti and all, considering dosha and all. But what was the cause for the manifestation, for the occurrence of that fever? If we look into the Jwara Chikitsa only, Abhishanga Jwara, there Acharya says, Vishaje Vishavat Sadhe, something like that. If Jwara is caused due to Visha, so you need to treat it like Visha. In Shota Adhikar also it is said, if Shota is caused due to Visha, you need to treat that Shota as Visha only, means you refer the treatment from Kalpasthana in Susha Samhita or Visha Chikitsa explained in Charaka Samhita. Those authors are only, they only have told like that. So that we need to bring in our clinical practice. For example, this patient, female patient, came with the complaint of vesicles on the face. Okay, here the clinical presentation is very, you can see Pitta dominant Agni, it is Visarga, okay, we can consider. So what is the Hetu? Tikshna Hetu, Tikshna Ushna, Katu type of Hetu will be there, Pitta Karahara, Vihara may be there, that has led it to this. So what should be the treatment here? Saumya and Pitta Shamana. This is general principles. This is about general principle. But when it comes to application of Agada principles, we completely change. Our principle change completely. Okay. Now what was given? Patola Katravanyadi Kashaya and Bilwadi Agada. Patola Katravanyadi Kashaya, you can see Patola, Katuki. These all are Tikshna, Ushna, Sukshma property they have. But they have Pittahara, Vishahara, Pitta Kafahara properties. When it comes to Bilwadi Agada is Ati Tikshna, Sukshma, Ushna property. It is being prepared with Ajamutra, Vastamutra. Okay, so it is very Sukshma in nature. So by that, within 5 days, you can see we got this outcome. Okay, this is the outcome of the use of Tikshna etiology disease and Tikshna Agada Aushadas were also given Tikshna. Okay, now consider this. This girl developed this kind of discoloration and little raised skin was there and she was having severe itching. And we gave only Dushi Visharagada internally and regular coconut oil for external application. After 3 days, you can see there is complete change in the clinical presentation. Only discoloration is there. That may take another few days to become normal. Now, what we gave? Dushi Visharagada and coconut oil, external application, coconut oil. Now, what was the assessment here? We assessed the etiology as maybe the glue that is used for in bindi and all that might have caused the allergy, and because of that she has scratched it and it has increased. So here what is there? The glue is not as Tikshna as compared to the Tikshna, Ushna, Katu, Ahara and all that are leading to the manifestation of Visarga. Okay, so here what we gave? We gave Dushi Visharagada coconut oil. Now Dushi Visharagada, when we compare Dushi Visharagada with that of Bilwadi Agada, Dushi Visharagada is more Saumya than Bilwadi Agada. So little basics, like in Visha Chikitsa, we get Chaturvishiti Upakramas. In that, 3 terminologies are there, which are Prativisha, Aushada, and Prashamana. Okay, Prativisha means administration of Vishagna Aushadis that contain Visha or administration of opposite Visha directly. Second comes the Aushada. Aushada is Vishagna Prayogas like Bilwadi Agada, Dushi Visharagada, the Shangagada, whatever we use. These all are Vishagna, but they do not have any Visha as an ingredient. Okay, they do not have any ingredient, Visha as an ingredient. The last one is Prashamana. Prashamana is for the clinical presentation, symptomatic relief. For giving symptomatic presentation, Prashamana is selected. Means Aushada or Prativisha are selected to treat the Hetu, whereas Prashamana is selected to treat the outcome, result. Okay, so Aushada is used to treat the Karana, Prashamana is used to treat the Karya. Okay, so now what was there? Due to some allergy, the skin lesions were there. So for that, what was given? Dushi Visharagada, that Hetu. Now it was just mere just needed some soothing type of external application. So coconut oil. That coconut oil is Prashamana. We'll discuss in detail. So in herpes in that patient, Patola Katravanyadi is Prashamana, Bilwadi is Aushada. In bindi allergy, coconut oil is Prashamana, Dushi Visharagada is Aushada. But here Bilwadi Agada is Tikshna, here Dushi Visharagada is Saumya. So that is why we need to keep always in mind that the 3 Sutra Ayurveda. Acharya Charaka has told this in the very first chapter. Even Lord Brahma transferred. Lord Brahma Hello? Please
I would request someone to please mute the audience.
mute them.
Excuse me, Dr. Bharti, you are. Can you just mute yourself? Thank you.
Okay, so three sutra Ayurveda. See, origin of Ayurveda itself is like from Brahma to Bharadwaja. It is transferred in the form of three sutra Ayurveda. That is Hetu, Linga, Aushadha. But in clinical practice, we most often forget Hetu. We concentrate only on Linga and Aushadha, and that is why we may not get. We are getting very good results even only with the Linga and Aushadha principle only. But imagine what will be the rate of outcome or result, or what will be the quickness or speedy outcome of the treatment when we start evaluating or considering Hetu also in our clinical practice. So I always like to give this example, like fighting guns with swords, like this type of fighting guns with swords. The people who hold the guns will 100% always win. That is why we suffered for 200 years under the slavery of British government, because they had guns and we had only the swords. Now, this is how the guns are the Hetu now. Present day Hetu, Visha is like gun. So the conventional line of treatment, for example, if Visha is the cause and clinical presentation is same, clinical disease manifestation is same of Kaya Chikitsa type of disease. In Visha Chikitsa, we want to get not a single disease or lakshana which is not explained anywhere in Nidansthana or Chikitsasana. We get same lakshana, same jara, same shota, same kandu, same pidaka, everything is same. But what is the difference? Hetu is different. So when something is being caused with the tikshnas like guns, and if we counteract or attack them with the swords, 100% will be failing. So that is why we need to fight tikshna hetu with tikshna deshila. Now, how tikshna versus tikshna? I think in Sutrasthana only Acharya Charaka says that Hita and Ahita. Now, the Tikshna that is coming from Hetu is Ahita Tikshna, whereas the Tikshna or Sukshma, whatever Tikshna Sukshma properties that are going through the Aushadha, that is Hita. That is the difference. When Ahita, same Sukshma Ushna Gunas from Visha come and harm the body because they are coming from Dravya, which is Ahita Dravya. Whereas the same Tikshna, Ushna, Sukshma properties which are coming through some Agadas, they are counteracting Visha and they are protecting the body. That means they are coming from a Hita Dravya. That is the major difference. So we need to treat according to the Hetu. If Hetu is Tikshna, so we need to consider. Now Tikshna means how the clinical presentation will be there. Acuteness of the condition. So condition will be quick in onset. Severity of the condition becomes very severe, even enough to put the life in danger, and extent of the condition, like nature, it will be fast progressing in nature. Now, all these conditions require quick attentions. We need to be very quick. So that is why what type of treatment is given here in such conditions, Agadas are used. Means without any second thought, without any doubt, we can use the medicines which will attend the patient or attend the disease quickly. Not only doctor, the medicines should also attend the disease or the pathology quickly. So that is why Agadas play a very important role in such conditions. So what is needed to bring in Agada principles in clinical practice? Directly you can bring, no problem, because the Agadas are medicines what we are going to discuss now. They all are non-Visha. They do not contain any poisonous ingredient. We can, without doubt, we can use. But to get more and more success rate, to get more success with the same medicines, we need to have these things. We need to develop a thorough skills to assess the clinical condition, understanding dosha, taratama bhavas, which dosha is dominant, which guna of that dosha is dominant and all. Then not only Agadas, along with Agadas, as per the dosha presentation, we should be able to understand Shamana Yogas. So how to assess Visha exposure in OPD setting, OPD in case of. So there, we need to use only simple thing. Karanat Karyanumana, Karyat Karanumana. I will give you a few examples. Very sorry if my voice is not clear, a little throat infection is there. Okay, so in this, we will be discussing about only two Agadas that for comparison, I have put the three. Now, Dushi Visharagada, Bilvadagada, the Shangagada, these are very effectively used in dermatological practices. These are, all the three are available in market. So among these three, Dushi Visharagada becomes Saumya, Bilwadi becomes Tikshna, and Dashangagada becomes Ati Tikshna, depending on the combination, the drugs it involves. So depending on that, we have to use whichever condition is required. So generally in clinical practice, like Dushi Visharagada in allergic manifestations and chronic itching dominant conditions which have recurrence in such patients, we use Dushi Visharagada. Mild infectious conditions like Pitta Kapha type of associated fever, pus formation, or that part and all, in such conditions we use Bilwadi. When the condition is very highly infectious and fast spreading, Pitta and Pitta Kapha dominant, in such conditions we can use the Dashangagada. Now we'll see 10 cases are there. I will try to complete or go a little faster. So this is a patient came with this type of erythematous clinical lesions. Don't worry about the diagnosis, whatever it may be. It may be erythroderma or erythrodermic psoriasis, whatever it may be. Clinical condition you understand. So here we can see the erythematous, mildly scaly lesions all over the body. It can be like pityriasis also. So whatever it may be, we have to assess clinical dosha presentation. So what we did, we gave Patolomuladi Kashayam. Pitta was dominant. So Patolomuladi, it is like a kind of Nitya Virechana type, empty stomach, Dushi Vishari 2BD after food, Guduchadi Kashaya 15 ml thrice daily after food, and Nalpamarad Taila was given for external application. This is second follow. So Patolomuladi we gave, so it causes more and more loose motion. So Vata Prakopa will be there. So after it is said in text that said Ratropa Yoga something. So I probably like you can use for 10 days or 5 days or depending on how many times patient had loose motions and all, depending on that you can use that. So then I replaced that with Patolocatronadi. Guduchadi became twice daily, Dushi Vishari became twice daily, Nalpamaradi shifted to Soria oil. Then all the complaints reduced, but to prevent the recurrence and all, a patient resides in Goa and humidity and all, the chances will be there recurrent. So that is why we did Virechana. Tiktagrata was used for Snepana, Nalpamaradi Telabanga with Rutleha for Virechana. Then follow-up medicines, Guduchadi Kashaya, Dushi Vishari Agada, and Yeladi Tela was given. Now Yeladi Tela, see, from Nalpamaradi Tela, Soria oil and Yeladi Tela. Now Soria oil should not be used in excessively Pitta dominant condition. So starting Pitta was more, so Nalpamaradi Tela was given with coconut oil mixture. So it became little bit Vata Kapha dominant or little Vata Pitta type. So we gave Soria oil. Then it becomes completely at the end when it became more, discoloration and all Vata dominance at that time. Yeladi. Here you can see the results after the treatment. Now, second patient, the patient came with the complaints of vesiculobullous type of presentations on her right forearm. In this, there was vesiculobullous lesions, severe burning sensation, mild swelling, and there was local temperature. And history is very important. This patient met with an accident and she developed a slight sprain on her right wrist, and for that she consulted a surgeon as per them, and they gave some gel for maybe a kind of analgesic gel, and she was asked to apply it. See, this patient tells us the need for patient education about our medicines. See, what happened, this patient gave this, actually I should not have put the name of that drug. Okay, it's okay, as it only cost. So what happened here, the patient was like, generally whenever pain is there, whatever oil or whatever we give, patients have the tendency of rubbing or giving massage and all. So what this patient did, that patient applied that gel and gave little massage, and then she gave a little sweda. Okay, she gave like fomentation and all. And next day onwards, she started developing vesiculobullous presentation. She was also having that. She was a known patient of diabetes. Now, after when they came to our clinic, our OPD with those lesions, as it was, we are other people, so we mostly focus on trying to find, like बोलते हैं ना, police हर व्यक्ति को क्या बोलते हैं, doubtfully देखते वैसे. So हम अगदा वाले हर condition में we try to search for is there any Visha exposure and all. So history revealed that the application of topical gel and all. So we thought it may fit into the Lepovisha. So why? Because not only that, clinical presentations also. Spotajanma, Ruja Srava, Tokpaka, Swedanam, Jara. She had Spotajanma, there was Ruja, slight, Srava was there, Paka was there, Sweda was there, mild fever, local rise of temperature was there. So it is Lepavisha or Abhangavisha. So we consider it under that Abhanga or Lepavisha, and it is Pitta dominant Kapha condition. So what treatment was given? Again, Patolakatroinadi Kashaya, Bilvadegata internally, Panchavalkala Seka, and Alphamred Tele for external application. Here you can see another important thing is not only giving right medicine, but how much we are giving, that is also important. Here, onset is very quick. Okay, Hetu is, we have to consider that it is very quick. So Hetu may be very Tikshna. So treatment should also be like that. So what we did, we gave the medicine 4 times here in this patient. Previous you saw 3 times, then twice. And here 4 times. 8 a.m., 11 p.m., 1 p.m., 5 p.m., 9 p.m. Both Patolakatroinadi and Bilvadi. Panchavalkala, once or twice it was given for washing. So here on maybe 3-4 days, this is 11th, and on 14th you can see vesiculobullous lesions still persisted, burning sensation reduced, local temperature reduced, but swelling increased. Here you can see the swelling appearance is more. So what we did, we persisted with the same treatment. To that we added only Punarnavadi Kashaya. Okay, what I was telling, we are now designing Prashamana. Okay, Aushadha we have given Bilvadekada, so we are making variations in the Prashamana. And this is on 19th, patient came for some other thing, and then it reduced by 22nd, but on 27th, patient came to our hospital for some other consultation, I think. At that time, I took the photographs. Here you can see the complete outcome with the only Patolakatroinadi, Punarnavadi, Bilvadi, Panchavalkala, and Alphamrid. This is a patient of, we can say, gutted psoriasis, former by profession.
Slides are not visible, sir.
Slides not visible.
Not visible, sir.
Just a minute, again I will show.
Visible, sir.
Visible,
No,
sir.
sir, they are visible.
It's
Visible.
visible.
It is
Visible,
visible.
go ahead.
Visible, sir.
Just
Maybe
a
they
minute,
have some
sir.
connection.
I closed this side. I'll come back. Wait. Here it is. Here.
Yeah, it's
Okay, this you can consider as gutted psoriasis. Okay, Vata Kapha dominant, but he's former by profession, and he is frequently exposed to these pesticides, fertilizers, and simultaneously Parthenium. He had all over the body these lesions. I kept all the 3 follow-ups in the same slide. Photos I'll show you. So when patient came to me, Gudichadi Kashaya, Dushi Visharagada, and Surya oil. Now here, Shamana is given less and Aushadha is given more. Gudichadi Kashaya twice, Dushi Visharagada 6 tablets per day. Okay, next Gudichadi Kashaya, and then Aragodadi Kashaya, Dushi Vishari twice. Okay, and Manjistadi Taila for external application. Surya oil in the beginning, now means in second visit you can see first follow-up, the lesion scaling and all have gone, discoloration was there. Next, Gudichadi persisted, we added like he was having more Vata and all, so we needed some Brahmana. See, whenever we feel like patient is going to expose to Vishas and all frequently, so then Vojo Vardaka should be given. So I thought Narasimha Rasayana will be good. So Arigvardhini for Dipanapachana, Narasimha Rasayana on empty stomach, Manjistadi Taila was continued. This is on second visit. You can see the lesions have gone, but discoloration is there. So for that purpose, Surya oil was stopped and Manjistadi was added. Second visit, you can see the lesions have almost gone, but discoloration. And this is totally at the end of the treatment. Okay. So what we used? We used Gudichadi Kashaya, Dushi Vishari, then Aragodadi Kashaya, Narasimha Rasayana, Arigvardhini, Surya oil, and Manjistadi. Okay. 7 medicines for 3 follow-ups. Okay. This is a child, maybe age, oh, I forgot, I lost that slide. 10 years or 11 years, a girl from Belgaum. She came with, palpable purpura type of lesions on both the legs, on the hands, and she even had on lower abdomen and thighs. So she was, when she came to me at that time, she was taking 40 mg Visolon, I think, per day in divided doses. And she was treated with antibiotics and analgesics, which were stopped by now. And it was diagnosed as leukocytoclastic vasculitis. So here again, see, as I told, we focused more on searching for etiology. So we need to keep in mind Karyat Karnanumana, Karnat Karyanumana. Now here what made us to ask for, because the clinical presentation was very quick, within the span of 2 or 3 days the patient developed it. And when you go to leukocytoclastic vasculitis, it is a kind of hypersensitivity reaction. So either there may be exposure to some drugs or some any gels or something like that, or there may be some plants or any insect bites, something like that. So we need to we have an idea about that. So कार्य तो देख रहे हैं, so कारण को ढूंढना है. So previous consultation where she went, she was not at all asked about the history and all. She was just diagnosed clinically by seeing the clinical morphological presentation, and she was prescribed with Visolon and antibiotics and analgesic. Patient who was having pain abdomen. Here, the history revealed before the onset of these things, the girl visited her grandmother's home in Kolhapur, and it was in, I think, vacation. While she was playing, she stepped on ant hills, and she got bitten by small red ants. Multiple bites were there on her legs, and we know that kids, when they are busy with they're playing and all, they neglect all those things. So she just wiped them, and he neglected that. And in span of 2 to 3 days, she started developing those reduced papules. And then they consulted the dermatologist, and it was diagnosed as leukocytoplastic vasculitis. And that said, medicine was given. So for us, we consider the clinical presentation as that Kita Visha, it is Pitta Kita Visha, because here you can see Alpa Samsrava, there is no Srava, very less Srava, or lesions appear more shiny, oily. Daha is there, Raga is there, redness is there, burning is there, Visarpavan, it is spreading. Okay, so that is why we consider it under Pittaja Kita Visha. So what treatment was given? Say I'm telling Potolocotronadi, Bilwadi, Dushvishari. These are the 3 drugs that I'm going to make sure you start using in your clinical practice. Okay, so don't feel like sir is repeating same. Practice makes man perfect. So I'm trying to make you people perfect in using these medicines. Okay, so Potolocotronadi 7 to 8 ml as per the age, thrice daily. Bilwadi 1 tablet thrice daily after food. Dushvishari 1 tablet twice daily on empty stomach. Okay, I will tell you later why Bilwadi and Dushvishari both very good. Nalpamradi was given for external application, and we gave steroid 40 mg was given written how much we have how to taper that one. So as the steroid tapering was started, the patient started developing more and more lesions. The complaints started increasing, and I'm very fortunate and or lucky we can say. Parents were very confident that they will continue persist to thyroid treatment even though the lesions were increasing. But the problem is, but the main thing is she was not having that much of suffering. Lesions were increasing, burning sensation and all those things were very less. So here you can see at this part there were no lesions at all. You can see on tapering these lesions. And then on 7C complaint of pain abdomen, I think at that time we gave usually these patients sometimes they have. So 1/4 teaspoon thrice daily it was given with Grita along with food like Pratama Kavala, and Alpamradi was replaced by Manjistadi and others were continued. So then again, I'm very fortunate that they were communicating with WhatsApp. Whenever I asked, they sent photographs. You can see this is no steroids since 4 days. Lesions are reducing, no steroids since 7 days. So we stopped medicine. Potolocotronadi continued Bilwadi and Dushvishari. Nalpamradi reintroduced. 4th November, this is only Dushvishari and Nalpamradi. Mid of November, only Nalpamradi. 22nd January, no medicine. 29th March, no medicine. Now, you may be asking why so much of follow-up was done in this, because leukocytoplastic vasculitis is the condition which reported to have very high recurrence. Like once a patient develops from leukocytoplastic vasculitis, chances of developing recurring such complaints even after mosquito bite or anything, any small stimuli, the patient will develop that. So that is why we wanted to make it a publication. So we wanted to go for a publication. So we followed the patient for 6 months, and still they are in communication, and that kid has not developed any further presentations. This is another same type of a patient, again diagnosed as leukocytoplastic vasculitis and treated like that, but we consider clinical examination. Here you can see in this on right leg, you can see there is a black spot. He was a safari driver by profession. So he went to hello.
I request all of you to please mute the. Yeah, thank you.
Now this he was a driver, a safari driver, and he took his team clients to Dandeli forest, and there he developed this on second day. So here you can see the bite marks. These are the bite marks. This patient here you can see these were neglected again in clinical diagnosis. Dermatologist gave treatment for leukocytoclastic vasculitis. It was not treated, and then patient came to us, and we diagnosed it as again Pitta-Jikita Visha, Patolakatronyadi, Bilwadi, Dushi Vishadi. On third day, Guduchari was added, and the Shangagada was introduced, and we gave Tiktagrata because more Vata was there, so we gave Tiktagrata. Patient was having joint pain, so he was having severe multiple joint pain, and we gave the Shangalepa. At that time, I had Erythyla with me. Erythyla is one of the very unique preparation used for managing bite wounds, snake bite wounds. It is there from Visha. It's not available in market. So that I used for a few days. So you can see 18th to 22nd, 18/5 to 22nd 5. Okay. In span of 7 days, we were able to manage the patient very effectively. These scars take more time. In that patient, that kid also you saw. Here, there will be petechial hemorrhage kind of things to do. So that staining will take more time. Now here, this is a patient from Miras or something. This patient was having complaint is he was developing keratinized, what you can call bumps like that, or a kind of hard lesions, discoloration on face. Neck means the parts that get exposed to sunlight. Okay, he was having it from maybe childhood, I think. And here you can see the solar exposure parts he used to have. There was mild itching. On legs, you can see they are highly dominant. So it was diagnosed as Darius disease as per the biopsy done in Mumbai. So when the patient came to us, it took a lot of time for convincing him because I was diagnosing it as Charma Kushta or Vata Kapha Kushta, and they were not ready to, because I was not knowing what is Darius disease. Then I read and okay, but somehow we convinced the patient, we admitted the patient. 2 times we gave Virechana, and Virechana, Kalyantagrata, Vata Kapha dominant, Elai Tela Benga, Vata Kapha dominant, Truth Leha and Draksha Jala was given for Virechana. So after Virechana, first follow up, what we gave Shamana, Patala Katranadi, empty stomach, Guduchari after food, Dushi Vishari Agada, and Eladi Tela was given. Second visit, Patola Katranadi continued, Mahamanjistari Kada added after food, Dushi Vishari, Eladi. Third visit, lesions started reducing Vata. So to take care of Vata and prevent the recurrence, Kalyanakagrata empty stomach, Sari Vyaso after food, Dushi Vishari internally after food, Eladi and Manjistari used for, like Eladi was used before bath, Manjistari after bath. You can see after 8 months of treatment, here it might not experience, like you can feel the actual outcome. I think I forgot. He sent photos on WhatsApp. I changed the phone and I lost those photographs. But important thing is he's going to college. He's exposing to, so he's having thorough solar exposure, but not at all developing any skin lesions. Here you can see the back of neck, on hand and legs, they were markedly reduced. Okay, this is a child came with a complaint of hypopigmented lesions on both the forearms and on the face. Now this was, I thought, like maybe as per the morphological presentation, we thought it is due to a kind of atopic dermatitis. So usually we consider atopic conditions as a Dushi Vishajanya Vikara. We consider like hidden, any etiology, if it is there, internal pathology, which is hidden. And whenever there is exposure changes, environmental or food, diet, anything changes, if clinical presentations occur, we consider them under Dushi Visha category, like Dushitam Desha Kala Nadiva Swapne Ravikshisha, that type of, in that fashion. So it is Karyat Karnanama. So Karya is, it is showing periodic appearance, variation in climate or diet and all. So we consider that. Kumaryasava, internally, she had little constipation type. It is given 10 ml twice daily before food, Dushi Vishari after food, Navaya Soloha after food, non-comparable therapy for external application. This is after 12 days treatment. So same, this is after 12 days treatment, and this is at the end. I think only once we gave these medicines. This was 400 ml, and this was some maybe 30 or 50 tablets. Navaya Soloha 10 days only given, Alpamil Teda only 1 bottle. And this is somewhere after 20 days or 30 days, say they came for some other consultation to other OPD, and luckily I saw the patient and I called in the OPD and I took the photographs. So again, what we gave? We gave Maraso, Dushi Vishari, Avayas Loha, and Alphamol. This is face lesions also, you can see. This is, as per modern, it is diagnosed as erythema annularis centrifuga. It is again a hypersensitivity clinical presentation, skin disease. This girl, when came to us, she was 21, I think, and she started developing these from the age of 9 or 8. In that period, when she was 8 years or 9 years old, she had some health issues and she was, I think, fever and all. She was given a penicillin injection. So she developed urticaria type of presentation as a allergy to that penicillin injection. But what happened? Those urticarial rashes, or we can call drug eruptions, they persisted and they started, developing like scaly lesions, small onion peel like skin started peeling, and she started developing those lesions periodically, repeatedly. Whenever she exposed to cold, whenever she exposed to cement dust, whenever she took any modern medicine, even paracetamol, she started developing, and she was treated, means from the age of 9 or 10 till she reached us at the 21. At that time, for that 10 years, they have not stopped any treatment. She was continuously on medicines, but still she used to develop these lesions. So when she came to us, we again, I told you, we consider those things like etiology as that Aushadha, maybe we can consider that Viruddha Aushadha type of thing. So again, we consider that Garajanya Dushi Visha. So Dushi Vishari Agada was given 2 tablets thrice daily with warm water, because see, Dushi Vishari we commonly give with honey. When I was asking them to take with honey, patient said even honey is allergic to her. Means she is allergic to honey. Means the pollen, maybe the pollen or something like that, which is little toxic sometimes, that also triggers her skin condition. So we gave it with warm water. Actually, we wanted to give Virechana, but she was reluctant to take ghee and all. So why do we did? I have a little like regular Virechana, Lagu Virechana, Nitya Virechana I have. So Lagu Virechana means you give some days or 2-3 days you give some Grita and all. Then 1 or 2 days you give Patalumba, like that. So in this patient, we did Nitya Virechana. Daily, twice daily, it was given 10 ml on empty stomach. It was given after food. Okay. So then, because he was having glucose, empty stomach, it should be given. It used loose motion. So after food, it was given, and she used to have more pain abdomen. Patalumba usually causes. So for this was done, this was followed for 1 month. 1 month means Patalumba was given 6 days or 7 days. Then gap, again 6 days or 7 days, a week gap or 5 days gap. But Dushi Vishari was continued for 1 month, 2 tablets thrice daily. Then gap of 2 months, and again 1 month, same treatment also. So this was done for 4 settings. It was done for 4 settings, means 8 months. During that period, she was not having any skin lesions, but still we did that one. But actually, this should not be shown as after treatment, because in this, the lesions will reduce whenever we give treatment, but recurrence, whether we were able to prevent the recurrence, that is the important thing. And we were able to prevent the recurrence. And this is a boy, student of our college student alumni. He developed these skin lesions all over the body after having some food outside food. So allergic manifestation, acute. Next day, I think today evening he had, and he started at night, he started getting itching and all. By next day evening, he developed all those lesions. Okay, so very acute. So Patologatorinadi, 15 ml thrice daily before food, Dushi Vishari 2 BD after food with honey, and coconut oil was given for external application. This is 3rd day, itching is less, throat redness is comparatively reduced. Here you can see. And this is on 6th day. You can see all the lesions have almost reduced. This is a patient we can diagnose clinically as plantar psoriasis or Vipadika or whatever. But here again, etiology. As per the patient, this was caused due to working more under soap water. मतलब bathroom में ज़्यादा काम कर देते, कपड़े धोना वगैरह. So soap water से start हुआ as per the patient's experience. So we considered it as Dushi Vishajanya, but as it is Vata Kapha dominant and patient is old aged, so we gave Grita, Tikta Grita, Aragavardhini for between food I usually give for Dipana Pachana. Tikta Grita 15 ml on empty stomach. Dushi Vishari 2 BD after food. Okay, from the 10th, 11th day, means after stopping Aragya. And Elari Tela was given for extra prevention. In this, what I have to do, we have to, like, patients usually apply only on the plantar area, but we should ask the patient to apply both on dorsal aspect of also. So means whole foot should be applied. And after 30 days treatment, you can see the outcome. So I think this is the end. I think I finished a little faster. So Agadas, one thing we need to keep in mind, Agadas alone will not be effective. Though we are selecting right Agadas, but that itself will be not effective. We need to give 100% outcome. To get 100% outcome, selection of right Shamana is also important. Prashamana means that requires the skill of assessment of clinical presentation based on the dosha association. Okay. Do not hesitate to use Tikshna Agadas even in Pitta dominant conditions if you are good at prescribing suitable Shamana yogas. Understanding Hetu plays very important role in selection of medicines, particularly like Agadas. And this is my always tell, don't try to copy anybody's treatment. Okay, rather understand why those medicines or those type of practice are done. Okay, hope it will not be a problem. I have a small announcement. AyurvedicSkills.com, the website is still under construction. We'll be launching a digital course on psoriasis management mastery in Ayurveda. It will be a 20 hours course, completely digital, 24/7. You can watch anywhere, and it will be a paid course. It will be like ranging between 8 to 10,000 rupees maybe, and I will be the instructor. And the details of this, everything will be maybe January it will be coming out, and it will be announced in my YouTube channel. I have a YouTube channel, Dr. Mahesh speaking. So if any of you are interested in learning, Charaka Samhita we are doing now. Dermatology I have stopped doing in that a little because there are some issues. And but Agada, Ayurveda basics and all we are doing. Please subscribe to my channel and watch the videos. Hope I was able to give something to practice, take home from this. Thank you. Thank you, everyone.
Thank you, Dr. Savalgimath, sir. And I'm sure it was a wonderful session and everyone will agree.
Sir, there are some doubts.
Yes, yes, we'll be taking that. It is a wonderful session.
Ma'am, you're on mute.
Sir,
Ma'am, you're on mute.
where are we use Bilwadi Gulika? Where are we use Dushi Vishari Agada? And where are we use Patol Katuroniati Kashayam?
Hello?
Yes, Dr. Priya.
Hello.
Hello?
Yes, ma'am.
Thank you very much, Savalgimath, sir. Actually, I was on a mute. Maybe I was not able to do it. Yeah.
Thank you, ma'am.
It was a wonderful session, sir. And I'm sure everyone must be like they agree that you have given altogether a different insight for dermatology practice. Because, now we understood that, for some cases why we were getting a delayed results. Because we were just fighting with swords. Now we'll definitely fight with guns. You have given us that confidence. Definitely. And, all the siddhantic, like, how you should know the hetu and about the tikshna can be treated with tikshna aushadhi. So it's wonderful. We will definitely like to hear you more, sir. So now we can take some, I think, few questions, sir.
Yes, ma'am.
Yeah, so we'll just see in the chat box if there are any questions.
Dr. Tariq is asking
Which Agada used in fungal infection with severe itching?
Maximum, usually we do not use, but Bilwadi Agada can be used if the condition is of Pitta, little bit Pitta Kapha dominant. In that condition, we can use Bilwadi Agada with suitable, like, Shamana Aushadhis, maybe Nimbadi Kashaya or Chandanasava, depending on clinical presentation. But generally, I do not use Agada Yogas in fungal infections. See, I was telling that we use Agadas when we suspect of Hetu. We are giving Hetu. Against Hetu, we are using Agadas. So fungal infection is a crimigenia. So we most commonly do Nimha Chikitsa in fungal infection, like Vilanga, Haridra, Amarif, that type of practice.
Please, sir, please set treatment for molluscum contagiosum.
I think if you are so much interested, you just search molluscum contagiosa and Ayurveda. in Google, you will get my article. One of my article is there. My student has published. In that, we have used Bilwadi Agada internally and Yavakshara and Bilwadi Agada plus Haritra, I think. And it is like powder mix is done and it is used as external application with lime water. Chuna ka pani se lagana chahiye. And it gives very good result. And Bilwadi Agada prevents recurrence.
Okay.
सर मैं दशांग लेप का यूज सर मैं अर्टिकेरिया में करता हूँ सर.
Okay, okay. I usually
करता हूँ सर. मैं कुटकी चिरायता के साथ में देता हूँ. अच्छा रिजल्ट मिलता है सर.
Okay, thank you. Thank you. Dashang, I was discussing about Dashang Agada, not Lepa. Dashang Agada and Lepas are entirely different. Agada is explained in Visha Chikitsa that I have not touched in this presentation.
Okay, sir.
Anyone? If
सर
anyone
इनका दोष अनुसार बता सकते हैं क्या सर? बिलवादी गुलिका.
मैं dose बोला आपको सभी. I think I explained as per the condition. In some conditions you saw I was using one tablet twice daily. In some I was using one tablet 4 times a day. In one I used one tablet twice daily or thrice daily. So depending on the clinical presentation, how quick is that clinical presentation? For example, in that patient with that gel allergy, we gave 4 times Patolakatvanadi and 4 times Bilwadi. Means the acuteness of the condition. The condition was acute. It was requiring so quick, what we can call intervention of the medicine. So we gave more. So Visha Adhikar, when it comes to Aushadhi Sevanakala of Visha, it is Muhu. So depending on the condition, we need to think about how much and all we have to give. It takes some time, but starting we need to be safe practitioner. Go with 1 tablet twice daily or something like that. As you start getting, just a minute. We are having national anthem at right now. I'll wait for a few seconds. Thank you. Thank you. We have that tradition of playing national anthem at 5 p.m. in college.
Wonderful, sir. Really very nice. Yeah. So there are few more questions. Bilwadi Agada, you mean Bilwadi Gulika?
Yes, ma'am.
Any other for bleaching planners, sir?
Hello. Bilwadi Agada is available in market as Bilwadi Gulika only. Gulika is like most of the like it is prepared by Kerala manufacturing industries, so Kerala pharmaceuticals. So they name them as Gulika. As such, in text we don't get any form for these agadas. It may be probably in the churna form, but to have more self-life, they are in tablet form. The classical name is Bilwadi Agada, but in market you will get it as Bilwadi or Vilwadi specifically, V in place of B. They, as Malayalam people, they use more V in place of B. It is used as Vilwadi Agada, Vilwadi Gulika, Dushi Vishari Gulika, Dashanga Gulika, like that.
There is one role of Agada Chikitsa in alopecia.
No, madam, we do not use. I usually use Krimigna Chikitsa for alopecia.
Then there is
any role in lichen planus?
Yes, ma'am, 100%. When you have more itching dominant lichen planus, at that time we usually use this one, Dushi Vishari Agada. But depending on, see what I was telling, selection of Agada itself is not sufficient. So with that, what is the clinical presentation? Whether that lichen planus is presenting more with itching than what we have to give. Agada we will give because it's the disease which is having recurrence and autoimmune involvement is there. So we'll give Agada for that. But for the clinical presentation, what your patient is showing, for that we have to decide on ourselves what type of medicines we can give. Sometimes we give Gritas directly, sometimes we even use Nimbadi Kashaya. So depending on, sometimes Bilwadi Agada with Nimbadi Gugulo or Kaishar Gugulo like that. So that is also essential, not only giving Agada.
Hello, ma'am.
Yeah,
Hello.
you can ask the question.
Ma'am. One patient is there, steroid dependent since 4 years. Then what is?
No, for what the patient is taking steroid therapy, madam?
Dr. Vaishali? Sir is asking for what the patient is taking steroid. Can you just elaborate? Okay, I think you can write the question on our Facebook and Instagram page, and sir can definitely answer the questions. Yes, sir. Yeah. So if anyone wants to ask, I think there is Dr. Jaiprakash Verma and Dr. Shashi Tiwari.
हेलो मैम.
Yes.
Yeah.
मैम सर नमस्कार.
नमस्ते.
बहुत बहुत धन्यवाद एक बहुत अच्छा सेशन देने के लिए सर.
थैंक यू.
और सारी टीम को मैं बधाई देता हूं कि बहुत अच्छी शुरुआत उन्होंने की है. तो सर हमारे पास एक पेशेंट है अर्टिकेरिया का. पिछले 3-4 साल से उनको समस्या है कि 3 महीने से उनको मतलब अर्टिकेरिया होता है. सुबह 4 से 5 बजे के बीच सोते हुए कंबल लिया हुआ ओढ़े ओढ़े ही उनको हो जाता है. और बचपन से उनको विटिलिगो की समस्या भी है. और एक उनको जैसे बादाम काजू कुछ भी ऐसे नट्स वगैरह खा लेते थे तो उनको नाइट फॉल हो जाता था. और दूध पीने से भी हो जाता है. घी वाली चीजें खा ली उससे भी होता है. तो उनके लिए रस दिया था.
दूसरे विषय दे सकते हैं पटोल मुलारी कषाय. एज all those things should be considered. Like पटोल मुलारी is highly वातकरा. It causes severe pain abdomen. So थोड़ा डाइट एडजस्ट करके जैसे वातकरा डाइट नहीं रहना चाहिए. But that type depending on how many times you want like loose motions, 3 times or 5 times, 6 times a day. Depending on that, you can give like morning and evening or only in the morning. Or you can give morning some grita. If it is so severe, you can give morning tikta grita on empty stomach. Evening on empty stomach, matlab around 6:37, you can give Putol Muladi Kashaya some 15-20 ml. So by the time patient goes to bed, patient will have some 3-4 times loose motion. And Dushi Vishari, you can give twice daily in the beginning, and after 10 days, you can make it twice daily. External application, depending on whether you can use Yeladi Taila, Sarshapa Taila, or Yeladi Taila, Sarshapa Taila mixed, depending on skin condition and whether you can use. But if any skin lesions are there, like, patient has scratched and because of wounds are there, then don't use Sarshapa Taila. It is Katu Taila, severe burning.
Wheels होते हैं रेडिश और सरसप तेल से ही उनको शमन होता है.
हाँ वही मैं अभी जो बोला आप वो ट्राई कर सकते हैं सर.
जी थैंक यू सर.
थैंक यू सर.
गुड इवनिंग सर. ईयर में फर्स्ट डिस्चार्ज होते हैं जैसे उसमें फाउल स्मेल वगैरह भी रहती है. अगर इस तरह ईयर से कान से अगर कान से कर्म से फर्स्ट डिस्चार्ज है
हेलो
यूज करना चाहिए.
Very sorry. Such patients we refer to ENT, and I have not seen, not attended any such patient. Okay.
Actually, I want to know the Agad, so I asked.
No, actually, I don't have any idea about that clinical presentation itself.
Okay, sir.
No, we refer those patients to ENT, so I cannot tell anything. Can't suggest anything.
Okay, sir. Thank you, sir.
Hello, good afternoon. Hello, good evening, sir.
Okay.
Yeah.
Go ahead.
Hello.
One by one, I think. Miss.
Hello.
Okay, Dr. Pooja.
Can I ask, ma'am?
Yeah,
sir. Sir. Good evening, sir. First of all, it's very informative sessions. Thanks a lot.
Thank you.
Sir, I have 2 questions. First is that nowadays I have a few patients who is senior citizens, like above 70 years, and they are suffering from Shwitra since long back, like 30 years, 20 years.
Madam,
and now they.
Actually, I usually not treat Shwitra. Very main because for me, I am not getting results. And as I told somewhere in between, I told like I am a safe practitioner. So I even hesitate to use this Bakuchi and all for external application. Because those are the things, if we are admitting the patient and we are doing, it will be good. like for the sake of one patient, I don't want to lose reputation, my reputation in front of 10 patients. They cause complications. And even if we are treating, I tell that outcome, there may not be result, but still sometimes patient insist to give medicines. So the patients who are under 30, under the age of 30 years, I give some medicines. Sometimes we get some result, pigmentation may occur, or we may, first aim of my treatment will be like preventing spread. That we achieve. But repigmentation is very difficult. I have treated successfully only 2 patients, to be very frank. But above 30 years, I usually do not treat leukoderma patients.
And sir, and another question is that, as per our dosha, Vata, Pitta and Kapha, where should we use this one, Agada? Like,
no, ma'am. I told that Agadas, 3 I told, Aushada, Prativisha, Aushada and Prashamana. Aushada is Agada, where you need not worry about dosha. Don't worry about dosha. You assess the hetu. How potent is the hetu? If it is not so tikshna, go with Dushi Visharagada. If it is little tikshna, go with Bilvadika. If very tikshna, then go with Dashangana. Now, Prashamana is where you are going to select the medicines for the doshas. Like burning is there, insect bite or something, we are giving like Dushi Visharagada we have given or Bilvadika we have given. Severe burning is there in herpes. So we can give Chandan Parpatakadi Kasha. Now, Chandana Parpatakadi we are selecting because Daha caused by Pitta. So there, for selecting Prashamana, we need to focus on dosha. But for selecting Agada, we need not worry about doshas.
Okay, thank
you. Thank you, sir. I think there are a lot of questions to ask, but you can always ask on our page, because I think because of the time constraint, I know there are many questions and we would definitely like to hear more from you, sir. But I think you can all put your questions on Instagram and Facebook page. You can join the page and then sir will answer. I hope, sir. Thank you very much, sir.
Yes, ma'am.
And now I invite Dr. Rupali Uttarwa to tell about our future activities. Dr. Rupali.
Yes. Yeah. Thank you, Dr. Priya ma'am. Firstly, about our future activities. Firstly, through this NIMA Dermatology Society, we will be organizing a webinar series called DERMA VEDA. It will be monthly once. Every month, we will be coming up with new topic and an eminent speaker who will share his knowledge, experience, and views on that topic. So it will be a key for successful dermatology practice. Secondly, we will be conducting an essay competition for UG and PG students. So the topics for this competition are, topic for UG is role of Samprapti Vigatana in skin disease management. And for this, the submission date is from 5th January to 30th January. And the result will be declared on 1st of February, 2023. And now for the PG students, topic is importance of integration in dermatology practice. And for this, the date of submission is from 1st March to 31st March. And the result will be declared on 50th of April, 2023. And now for both of these competitions, there are certain rules and regulations. Number 1 rule is this: content should be original and unpublished. Second, candidates should submit essay on email ID, that is official email ID of NIMA Dermatology Society, that is NIMA Dermatology 2022@gmail.com. Third point is, essays will be scrutinized by our essay committee, that is of NIMA Dermatology Society, and the result will be final. One more important thing is that there will not be any entry fees, but definitely prizes are there. Prizes are likewise. First prize is of rupees 3001, sponsored by Dr. Shivanand Patil Sir's Twacha Ayurveda Super Speciality Skin and Hair Clinic, Kolhapur. Second prize is of rupees 2001, sponsored by Abja, which is an Ayurvedic beauty and wellness brand by Dr. Priya Patki ma'am. And third prize is of rupees 1001, sponsored by Dr. Sujata Solanki ma'am. And now for PG essay competition, prizes are same. First prize is of rupees 3001 sponsored by Sharayu Pharmaceutical Division of Celesta, and second prize of rupees 2001 and third prize of rupees 1001 are sponsored by Life Care Formulation Private Limited. So this is in brief narration of future activities. Thank you. Over to you, Priya ma'am.
Thank you very much, Dr. Rupali. And all the information is already there on the Facebook and Instagram page. You go through it, and I want that all of you should participate with large numbers. There are exciting gifts also available, and we want all your participation. Now I welcome Dr. Nikita Udeshi to just give vote of thanks.
Just a minute. Before the vote of thanks, so there are some inquiries are there regarding the registration of the our membership of the Dermatology Society. So number one, some people are asking about the links. So we are having the NIMA Dermatology. Okay. So NIMA Dermatology is our Facebook and Instagram page. So everything will be updated through our pages. So you can follow the pages for future activities like the webinars and essay competitions. And about the joining membership, so NIMA Dermatology Society just started the activities. Soon we are going to start the memberships for the Dermatology Society. Initially, the eligibility criteria is the doctors who completed degree, diploma, or a certificate course in dermatology, they are eligible to become the members. And the fees will be, if the member is a NIMA member, for them it is 5,000 rupees lifetime, and for non-NIMA member, it will be 7,000 rupees. So again, this membership, everything will be announced soon on our Insta and the Facebook page. Thank you very much.
Thank you, sir. Over to you, Dr. Nikita.
A very good evening to all of you. Yeah, thank you, ma'am. Yes. A very good evening to all of you, the dignitaries present within the screen and behind the screen. It's a huge day for all of us. The NIMA Dermatology Society has organized its first ever online webinar series called VEDA. We have received very warm and encouraging response from the doctors across the nation. The registration had crossed to almost more than 800 participants. So it's a really proud moment for us. It gives me immense pleasure to propose a vote of thanks for today's event. Firstly, I would like to express my heartfelt thanks to our Honorable Treasurer, NIMA CC, Dr. Ashutosh Kulkarni, sir, for his immense support and guidance. I thank you, sir. Moving forward, I would like to thank Dr. Vinayak Temburnekar, sir, President NIMA CC, for his honest remarks, suggestions, and advices that led the smooth conduction of today's function. I would like to take this opportunity to thank and extend my heartfelt gratitude towards my teacher and guest speaker of today's event, Dr. Mahesh Savalgimath, sir. Your lecture and your conduction of this webinar was amazing as always. Thank you for this knowledgeable session, sir, and I'm proud to be your student. Talking of teachers, how can I forget the driving force behind the NIMA Dermatology Society Council and its activities? As Priya ma'am said, the ever enthusiastic, our beloved President, NIMA Dermatology Society, Dr. Shivanand Patil, sir. I thank you, sir. Thank you. This event and its success could have never been possible and accomplished without the support of the faithful audience, just like you all. From behalf of this, the office bearers of NIMA Dermatological Society, I thank each and every one of you present over here. And for more information and upcoming events of NIMA Dermatological Society, please like, subscribe, and stay tuned at our Facebook page, our Instagram page, and our YouTube page. Thank you. Thanks a lot.
Thank you, Dr. Nikita. And thus I announce that the session is come to an end. Thank you very much. Thank you all.
Thank you.